But I think there are two things that are important to understand. Number one, with respect to California, for example, the problem, as was presented yesterday in California, was not that there were a whole bunch of insurance companies from other states who were clamoring in to get into California to sell insurance to those individuals who saw their premiums spike by 39%. There weren't. The problem has to do with the fact, according to them, that people who have lost their jobs now, who are healthy and can't afford the individual market, have basically just decided, I'm going to go without insurance. I'll see, I got to take my chances because I just can't afford it. What that's left is people who, because of pre-existing conditions, because of special health care needs, because of age, they have to keep their insurance, and so the pool has become older and sicker. Now, the way to get at that problem is actually what we've discussed earlier, which is to broaden the pool. Make sure everybody's in the pool. And that's what the exchanges do. I actually think that on the purchasing insurance across state lines, there may be a way of resolving the philosophical difference. Not entirely, but there's a potential way of bridging this gap, and that is to say that once there was a national exchange with some minimum standards, then potentially you could just have a national marketplace and anybody could be able to sell into the exchange. This is something that Mike Enzi just mentioned. I actually think that could be workable once the exchange was stood up. So there may be a way of bridging this difference. Yeah. Now, on the mandate, though, because the mandate issue is connected, and so I'm just going to mention this real quickly and then I will move on. When I ran in the Democratic primary, I was opposed to the mandate.
Bless you.
Well, because my theory was, you know what, people, the reason they don't have health insurance isn't because somebody's not telling them to get it, but because they just can't afford it. And that if we lowered costs enough, then everybody would be able to get it. So I was dragged kicking and screaming to the conclusion that I arrived at, which is that it makes sense for us to have everybody purchase insurance. And I have to say, this is not a Democratic idea. I mean, there are a number of Republicans sitting around this table who have previously supported the idea of an individual mandate, responsibility. The reason I came to this conclusion is twofold. One is cost shifting, which is a fancy term for saying everybody here who has health insurance is one way or another paying for those who don't. Every time somebody goes into the emergency room, if Jay's son got hit by a bus and his dad wasn't Jay Rockefeller, and he ends up in the emergency room, we'd give him emergency treatment, and we don't pick up the tab. And the calculation, not our calculation, but independent economists, is that each family with health insurance right now is picking up $1,000 to $1,100 worth of costs for people who don't have health insurance. So when Tom Coburn earlier said, you know, if a kid comes to the emergency room, they're going to get treated. Yeah, they will get treated. Who's paying for it? Well, we're paying for it. Every American family who's got health insurance is paying for it. Every employer who is covering their employees is paying for it. So we're already putting the money in. It's just in a very inefficient way. And so the notion that somehow if we don't ask people to carry their responsibilities that we're saving money, no, we're not saving money. It's just we don't see it. It's called uncompensated care, and we all get charged an extra $1,000. So that's part of the reason. The second reason has to do with the issue of pre-existing conditions in the pool that we've already discussed. But I just wanted to address those two issues. Marcia, you had one thing that you wanted to respond to?
Yes, Mr. President, I did very quickly. I would just suggest that we're looking at this from, in your example, we're looking at it the wrong way. You're talking about letting companies into California. I'm talking about letting individuals out.
No, it's the same idea, Marcia. It doesn't matter whether the companies are going in or people going out. I promise you.
Free it up.
No.
Free it up.
I promise you that the problem that's going on in California is going on in every state. It's not unique to California. It's not as if there are insurance companies that are given great deals in Iowa. That gentleman farmer who just talked about it, these are some structural problems that exist in every state. It is what is true.
Yes. Let him
No, I want to say this. Hold on a second, guys. What is absolutely true is that some states probably have higher mandates than others, and so you can probably attribute a certain amount of the cost in a a state that has more requirements for bare minimum coverage, doesn't allow, drive-by deliveries or requires mammograms or what have you. Those things all may add some incremental cost, but the truth of the matter is that that's not the reason that you're seeing such problems. In a lot of states, the problem is just you don't have competition at all. We want competition. We just want some